I'm weary from talking about COVID. The people I represent are weary. We're all, I think, weary at this stage, and I suspect nobody more than yourself, Minister. But notwithstanding that, I'm here, along with some of my colleagues, to oppose this bill and to try to explain in brief why I'm opposing it. In March 2020, in the first substantive debate after the last general election, I sat over there and I recall sitting beside Deputy Connolly, as it happens, and we were both very concerned, as I think many people were, by the extraordinary powers that were being given over to the government to make law, to make regulation, without any degree of accountability or debate. But we did it because we, I suppose, were obviously concerned with what the news that was coming in, and we were told it was for a short period of time. And I suppose during the first lockdown, we were told that we were locking down to flatten the curve, just for a couple of short weeks, and we'd flatten the curve. And the curve was flattened. COVID wasn't eliminated, but the curve was flattened, and slowly it started to spread again. And then we had another lockdown in October, and that lockdown was so that we could all save Christmas, or have a meaningful Christmas. Now, I always thought that was a very dubious basis upon which to lock down, but it was one that was dreamt up by members of NEFIT, no less, so people generally went along with it. And then, of course, we locked down after Christmas, and it was a very long lockdown, and we were told that we were going to ease the restrictions slowly so that we wouldn't have to go back. But we would lock down until enough people were vaccinated, and we were told that would be 80%. Not by you, Minister, I accept, but by various experts in the media. And then we were told that 80% of adults wouldn't be enough, that we needed more people vaccinated, so we needed to stay locked down a little bit longer to achieve that. And we did that. All the while, you wielding these extraordinary powers that had been granted by the Dáil to the Minister for a very short period of time. But those powers were extended, they were extended again, they were extended and we were told they wouldn't be used, and now we're told they will be used. And now we're told the powers which are to expire, because we were told they wouldn't need to be used, are being rolled over again. And you tell us that they'll be rolled over until the 31st of March, and that they can be further rolled over again and again in the cases of some of the measures, but others can only be rolled over once. But of course, another piece of legislation like this can be introduced. So my question at this stage is, when are we locking down or imposing restrictions? Until? When is the end point? I listened quite carefully to the debate, and Deputy Durkin came in and said that we need to see this out, and I hope I'm not misquoting you. You said we need to see this out until the end. But I respectfully ask, what does until the end mean?
Until the people are safe.
Until the people are safe. Because I don't know of any immunologist or serious academic on the issue of COVID-19 who says that it is going to end. So safety is always relative, and complete safety is always impossible to attain. I suppose increasingly people have elected governments to keep them safe, and government have taken more and more and more powers in order to keep people safe, yet unfortunately safety is unattainable. So again I ask, when is the end? And are we talking about the end of COVID? Because if we are, I fear that we're deluding ourselves. Because if we're talking about locking down and restricting essential freedoms until the end of COVID, well then we're talking about restricting them forever, because nobody is suggesting that COVID will come to an end. Or are we going to impose these restrictions until we reach the end of liberal democracy as we know it? And I'm not just talking about Ireland. In fact, I know the Minister has left, and I'm sure for good reason. In fact, some of our restrictions look mild compared to what we see on the television screens from places like Australia in particular, but many other countries. But we are, in my view, witnessing the end of liberal democracy, or even democracy as we know it. Because democracy is more than a tyranny of the majority. Democracy is the ability to question regulations, to question laws, to ask the basis for them, to probe whether the underlying assumptions are correct or not. And we haven't had that, I say with respect, because those who are effectively determining what we should do, are not amenable to this Dáil, because they're not members of this Dáil. They don't have a duty to come before this Dáil. They advise the Minister, or rather advise the public and the media what they're going to advise the Minister, and put it up to the Minister to do that. And if he does it, he has them to fall back on. If he doesn't do it and things go wrong, and they will, because we will not be safe, because COVID will not end, then he will be pilloried for not having followed the public health advice. But the public health advice is focused on one thing only, and that is the suppression of COVID-19. Now, the suppression of COVID-19 is something that I support and always have, but I don't accept that it is the only basis upon which we should be running our society or our economy. And I'm not saying that economic rights are more important or our economy is more important, but we do have a healthcare system which is dependent upon an economy to function. I just want to go a little bit into these powers, because we had a COVID committee at one point. Indeed, the Minister, who unfortunately isn't here at the moment, was a member of that committee. And we had a former Supreme Court judge from the United Kingdom address us. And he said the following: if the government is going to confer extremely drastic powers on the executive or ministers, it is extremely important to have a very high level of parliamentary scrutiny. These powers should only be available subject to parliamentary confirmation and regulation, and they should have a very limited duration and be open to renewal. It seems to me that for democracy it is absolutely fundamental that the legislature should not forfeit pretty well day-to-day control of what ministers are doing with powers which in any normal circumstances would be regarded as inconsistent with basic democratic laws. And then he concludes, I've read the Health Act 1947, which is what we're essentially extending. And he said, it seems to me that the provisions for parliamentary scrutiny are virtually non-existent. That seems to me, as a Democrat, to be questionable. Now, you don't have to go to England to find this criticism. A group of academics in Trinity examined the whole thing and reported in August. And they came to the conclusion that the relationship between government and NPHET and the locus of power in that relationship isn't always clear. And that is essentially the construct that we are extending and rolling over in the legislation. And that is why I am opposing it, as a Democrat who is democratically elected. And you know, the people can get rid of me at the next election. Possibly they will. I actually agree with you. I think we will see a sea change at the next election, hopefully for the better, perhaps for the worse. We'll see. But the assistant...
5 minutes.
Yeah, the assistant professor in Trinity said that the overarching finding of this report is a significant lack of transparency in how and why important decisions were made during the Covid-19 pandemic in Ireland. Transparency and clarity are key aspects of public health governance, and one of our recommendations of this report is the need for far more transparency. If we don't have clear lines of decision-making and accountability and a clear sense of the power resting with the government, then the idea that we can have even notional democratic oversight for those powers seems very remote. That is undoubtedly a cause for concern. And it is because that is the very construct that is being rolled over, I must, in conscience, oppose this. I am not opposed to public health doctors giving public health advice. I am opposed to the abdication of parliament accountability in a democracy to public health doctors. I believe it is wrong, I believe it is dangerous, and I believe it will end in a crisis, because Covid-19 shows no signs of ending and nobody is predicting it will end. So on that basis, I oppose this bill. Thank you.